Hey, so have you ever noticed that sometimes when you're sitting for long hours and you feel a pinch, maybe on one side or both sides, right on the top part of the knee, which is your hip flexor, it's coming along the hips all the way at the front, and you feel tightness every time you're waking up. Or waking up, I mean to say, coming off the bed or getting out of the chair when you're working, you feel like, why am I feeling that tight? So what you also do is you would have seen exercise where we go for 90, right? So what I mean is like you go into a 90 position first. You go in this position and you still feel that, like I've seen this drill, but it doesn't really help me. And it could be the reason why is because you're placing your hands both at the back. And it might aggravate it because it's working all the way coming from here. And then it's coming towards your back, right? So what we're going to do instead of that, you can still do the 90-90 because there's no harm in doing that. And all you're going to do is you're going to do this exercise within your limitation, what your body is allowing you to do. So what I mean is if you're in this position, see how my hand's at the front? All you got to do is you turn around and place your hand right here. So now it's less stress on the hip flexors right now, and you can do it more better. Rather than if I place my hands at the back like this, you might feel tight and you might want to lift your legs up and you might say, hey, I'm not really getting the best, or I'm not able to optimize this exercise properly. So this is one. So I'll show you how exactly what I mean to say is you're in this position, I'm going to go out here. When you turn, you just bring this hand, turn the side. Here, go, turn the side. You see what I'm doing? So you don't have to be perfect in doing the exercise where you're just going in this position and you're finding, hey, I'm feeling it tight. You can basically modify this exercise. The next exercise, what you can do is, I'll advise you to get a mini band. They're pretty handy, right? So we're gonna bring this above your knees, right above the knees, and then I'll go into like a side plank position. Once I'm in a side plank position, I'm gonna first make sure that you push your hips forward, you squeeze the hips, making sure that you're not stressing your lower back and you're forming a straight line. And then, the foot, I'll be placing them on each other. So the top foot will be on top of the foot of the other leg, the one at the bottom. And then from here, while keeping your hips squeezed, what you gotta do is you gotta open and stretch and pull this band, and you will start feeling a good stretch coming all the way on the top part of the hip, which basically is the friend of this to release the tension from there. So you will go up and then hold for like 5 seconds. And when you're doing this, breathe, right? So it's really important to breathe. Make your core tight, 5 breaths, and then you come down slowly. And again, relax for some time. Want to go out, up again, and again, keep pulling it, right? So if you do this drill together with the 90-90, and you're going to combine this exercise with the band, this will help you release a lot of tension away from this exercise. Enjoy this workout. Let me know how you feel in the comment below. And if you have any more pain later, let's talk about it. How else we can combine this with a strength training exercise or program, which will help you feel better about yourself.